Good day, colleagues, and good day, everyone who have tuned in today and to watch or to listen to my normal program on diabetes wellness, diabetic survival, and health wellness. I remain my humble self, Dr. Vincent Iraganachi. I am going to discuss about some of the complication of diabetics with special focus on gangrene. So gangrene is one of the complications diabetes could bring on to the body. And what is gangrene? So gangrene is simple. It means when your tissues begins to die due to no blood supply, or due to infections, or due to diabetics. So these issues lead to arteriosclerosis. It could lead to infection, and there will be no blood supply to those tissues and organs in the body, and that will be, the death of the tissues. It happens most, in the arms, in the lips, which can lead to eventual amputation. So diabetics is one of the, causative factors that can lead to gangrene. And that's why today I want to talk about gangrene, what causes gangrene, ways to prevent it, and also, the signs that might come up. And there is, this issue is coming up. So some patients suddenly see bruises, like pink bruises, might be reddish, might be dark, depending on your complexion. They might be lower to the arm, some part of the arm, some part of the legs, and you notice there is, you have uncontrolled diabetics, or you have some kind of infection coming up. Those things could be markers of gangrene, in the sense that blood vessel to those areas are gradually dying off. And that's more reason why you need to see your specialist endocrinologist, or you see your healthcare practitioner available, depending on your country, in the country you are. So these are the signs you might see, and you need to go on to see your healthcare practitioner. Also, some people have uncontrolled, blood sugar, and for years they do not know, and all of a sudden it might just come up due to micro or macrovascular complications of the blood vessels, which can eventually lead to the death of the tissues because of very poor or low blood supplies. So when you notice that you have been in coma due to diabetics, and also you have a serious infection, maybe, with diabetics as well, you have to make sure you run the several tests, like a microfilament test, to make sure that the sensitivity of the food is still intact. So that's very important. When you note when the monofilament test is done, it could dictate early signs of poor sensitivity to the food, which might have led, or which could lead to peripheral vascular disease, and this could be, taken care of as quick as possible. So these are the little ways, the signs that can come up, and ways they present, and then you can eventually know what to do. What are the ways to prevent this? I must tell you, doing the normal blood glucose test, fasting blood glucose test, is normally okay, but you should be able to know that the HbA1c test should be required at least once in a year, or at most every 6 months. So far you have diabetics. I've had, I've had several episodes like the hyper episodes of diabetics. You have to have the HbA1c done, and this checks for the sugar in the blood for about 3 months. Try to know how this has been to make sure that you receive the appropriate treatment for yourself. So the normal blood glucose test is okay. You can calibrate that, have it around, but always try to see that you have the HbA1c test. So these are the things I've talked about. The monofilament test, you need to always try to present yourself to your podiatrist, who will check your legs. And when you notice there is wound, do not treat. When you treat, it could lead to infection and eventual gangrene. Try not to treat, but retire back to your podiatrist, to your PN, practicing nurse, and they will look after yourself and make sure that this does not lead to infection. And appropriate wound management will be given to that. So treating yourself is very bad. Then self-medication is wrong, especially people in some countries that believe in the use of herb. Yes, herb is great, But in some cases, you should make sure that you are sure of the professional who is prescribing the herb for you. Because I know back in our countries, African country, we have great herb, and those herbs were so great. But make sure this professional is satisfied by the government. They know how to do this. And when you are taking this, make sure it's being monitored. Is it improving, or is the leg getting worse? So make sure you don't go rub any balm, drink any herb without knowing the effect in the system. Are they positive or negative? It's very important. So these are ways you prevent this gangrene from getting hold. And also, no self-medication use. Like I said, unprescribed medication of any sort should not be used. Some can worsen the case and even make the complication of diabetes to get worse. So there are so many studies we have done which shows that patients who are on, let's say, normal metformin tablets could end up with insulin after maybe 9 years or 8 years of using such medication for type 2 diabetics patient. So it doesn't mean that you did not manage your diabetics well. It doesn't mean that. It doesn't mean that you are not great managing it. No. The only difference there is that the body system tends to need insulin to get you better. And that's why some people don't even go on to get the required periodic treatments or periodic management they deserve, like checkups, to see if the medication is working well for themselves, comparing maybe with other health complication. So gangrene could be really avoided if you control your blood sugar well, if you take safe medication, if you meet the appropriate healthcare practitioner you need to meet. And at the end of the day, if it gets worse, that is a full-blown gangrene and nothing could be done. At the end of the day, the medical professional may decide for amputation so that the infection does not spread. And in these cases, it might be the only option. So it's better to live healthy than for the person to lose their life. So I wish you guys all the best. And I hope this piece of, what I call lecture makes sense for you guys. I love you guys, and thank you for listening to Diabetic Survival and Wellness. Love you. Bye.